In today's lecture, we are going to start next chapter, anti-thyroid drugs, in which firstly, in earlier lecture, we discussed about thyroid hormone, pharmacology of thyroid hormone, that is location of thyroid gland. Thyroid gland secretes three hormones, thyroxine and triiodothyronine and calcitonin, in which these T3 and T4 are the important secretion of the thyroid gland. Then calcitonin, it maintains the role of calcium. That's why it is secreted into the thyroid gland. Then after that, we discuss what is meant by hyperthyroidism. What is meant by hyperthyroidism? Is there is increase in level of thyroid hormone or decrease?
Increase.
Increase.
What are the symptoms of hyperthyroidism?
Fatigue, weight loss,
Loss, pain away.
pain.
Okay, so this image shows the location of thyroid gland. Thyroid gland, it is a small organ and it is located in the front of neck around the white pipe, that is around the trachea. It is shaped like the butterfly. So this is about location. The next point, hyperthyroidism. Hyperthyroidism, it is a condition or the disorder in which there is excessive synthesis of T3 and T4 hormone, that is thyroid hormones. Then it leads to hypermetabolic condition of thyrotoxicosis. Thyrotoxicosis means there is excessive secretion of thyroid hormone, that is thyrotoxicosis. Then symptoms of the hyperthyroidism are thyrotoxicosis. It means that too much thyroid hormone secreted in our body, that is thyrotoxicosis. Then there are the symptoms observed after the hyperthyroidism disorder, such as fatigue, sensitivity to cold, then memory problems, goiter, hair loss, muscle pain, trembling hands, and infertility, as well as weight loss and depression. So this is about hyperthyroidism. So in the hyperthyroidism disorder, there is increased the level of thyroid hormone in the body, is known as hyperthyroidism. Then how to treat this hyperthyroidism disorder? So for their treatment or the management of this hyperthyroidism disorder, some agents are used. That agent is known as anti-thyroid drugs. So definition of anti-thyroid drugs, these are the pharmacological agents. When they administer, then they relieve symptoms of thyrotoxicosis effectively. Thyrotoxicosis means there is too much or increased level of thyroid hormone in the body. This increased level is decreased by this anti-thyroid agent. So these are the agents, they are used in treatment of thyrotoxicosis as well as hyperthyroidism. So next point is classification. In their classification, they are mainly classified into 5 types. So first one is inhibitor of hormone synthesis. Their example, carbimazole, metimazole, propyl thiouracil. Then second class, inhibitor of hormone release. Their examples, iodine, then iodides of sodium and potassium, organic iodides. Then third class, radioactive iodines. Their example, radioactive iodine, that is I-131. Then ionic inhibitor. Their examples, thiocyanate, perchlorates, nitrates. Then last class, organic antithyroid drugs. Their examples, thioamides such as propyl methimazole, and carbimazole. This inhibitor of hormone synthesis and organic antithyroid drugs, they are having the same examples such as carbimazole, metimazole, and propyl. So this is about classification. So how many classes in antithyroid agent?
5.
5. 5.
So antithyroid agent mainly classify into 5 types. Roll number 56, are you present?
Hello. Yes, ma'am.
Tell me the classification of antithyroid agent. Screen is visible?
Yes, ma'am.
Okay, then read the slide.
Yes, ma'am. Inhibitor of hormone synthetic. Example: carbinazole, methinazole, propythiocorsis. Second, radioactive iodine 130 I31I radioactive iodine. Third, inhibitor of hormones release. Example: iodine of NAK, organic iodine. Fourth, ionic inhibitor thiocyanate, SCN perchlorates, PLO4 nitrate, NO3. Fifth, organic antithyroid drugs, thiamides such as propyluronazole, methylazole, carbinazole.
Thirty-two. Are you present? Roll number 32. Am I audible to all?
Yes, ma'am. Yes, ma'am.
Roll number 32.
Yes,
Are you
ma'am.
present?
Yes,
Read the classification.
there are two classes: inhibitor of hormone synthesis and
How many
radioactive.
classes?
4 classes, ma'am.
4 classes is visible in your screen. Remaining student, how many classes?
5 classes.
5
classes.
32. Continue it.
First is inhibitor of hormone synthesis. Second, radioactive iodine. Third is inhibitor of hormone release, ionic, and 4 ionic inhibitors. Inhibitor of hormone synthesis मध्ये कार्डिओक्सोल, मिथॅमॅझोल आणि पॅरोपॅलिथोरिसिल. रेडिओक्टिव्ह आयोडीन मध्ये मॅम ते कसं रीड करायचे?
Last class. 32. Which is last class?
Organic antithyroid drugs.
What is meant by antithyroid agent? Define antithyroid agent. Question for you. Roll number 32. Roll number 32. Are you present?
Yes, ma'am.
Then why you are wasting time? Define antithyroid agent. Why they are used?
Antithyroid drugs are currently available in United States.
I want proper definition.
एक मिनिट.
Roll number 32. If your attention is somewhere, then you can free to leave the meet. There is no need to attend lecture. Can anyone define antithyroid agent?
These are the pharmacological agents.
Pharmacological agent which administered externally means the symptom of the thyroid.
33. You continue. रोल नंबर 23 बाकीच्यांनाही आन्सर सांगू द्यात.
Yes, ma'am.
These are the
33
pharmacological agent when administered externally manage the symptoms of thyrotoxin effectively.
what is mean by thyrotoxicosis? 37 roll number 37 definition सांगितली तुम्ही आता. what is mean by thyrotoxicosis?
Yes, ma'am.
Thyrotoxicosis means पवार विद्या.
Yes, ma'am.
So after the classification, let's see the next point. Mechanism of action. So mechanism of action of antithyroid agent, it inhibits the iodination of tyrosine residue in thyroglobulin. Means they inhibit iodination of tyrosine. That is thyroid hormone जे iodination होतं ते antithyroid hormone inhibit करतात. And also coupling in between the T3 and T4 hormone. What is mean by T3?
Triiodothyronine.
And T4?
Thyroxine.
Thyroxine.
Boyd said, what is mean by T3 and T4?
T3 means thyroxine and T4 means triiodothyronine.
Triiodothyronine and thyroxine, that is T3 and T4. So there is coupling in between this T3 and T4 hormone. This coupling is inhibited by antithyroid agent. Then it do not affect the release of T3 and T4. Also this agent do not affect on the release of T3 and T4 hormone. Then some adverse effects are observed such as hypothyroidism, goiter, agranulocytosis, intolerance, skin rashes, and joint pain. What is meant by agranulocytosis? Any idea? Granulocyte and agranulocyte. माहिती आहे? RBC, WBC, platelets. In which cell there is granulocytes and agranulocytes?
WBC.
Present नसतात
Agranulocytosis. It is a life-threatening blood disorder. So these symptoms are observed. Goiter means what happened in this disorder? There is abnormal enlargement of thyroid gland because of increased level of iodine. Then hypothyroidism. The next intolerance, skin rashes, and joint pains. So these are the antithyroid preparations. Propyl thiazide tablet USP 50 mg. Propyl thiazide, it is example in which class?
Inhibitor of hormone synthesis.
Inhibitor of hormone synthesis.
Thyroid gland जे हार्मोन सिंथेसिस करते आणि जर त्या हार्मोनचं सिंथेसिस if there is excessive synthesis of this hormone in the thyroid gland, then what happen? Hyperthyroidism is occur. So to treat this hyperthyroidism disorder, the agents are given such as antithyroid agent, that is inhibitor of hormone synthesis. When after the administration of such agent or medicines, those containing propyl thiazide, methimazole, carbimazole, then they inhibit or stop the excessive secretion of this hormone. And because of stopping or inhibition of this excessive secretion of hormone, it recover the hyperthyroidism disorder. So by this way, all these agents act and inhibit the excessive secretion of thyroid hormone and to treat the hyperthyroidism disorder. So let's see firstly from their classification iron inhibitor, in which firstly definition of goitrogen. What is meant by goitrogen? Can anyone read the definition?
These are the pharmacological agents which, when administered, interfere with thyroid hormone synthesis and decrease hormonal level in blood.
Okay, so when hyperthyroidism disorder is occur, at that time these goitrogen agents are given. Then how they act to treat this disorder? So these are the pharmacological agents. When they are administered, they interfere in thyroid hormonal synthesis. Thyroid gland secrete which hormone? Of course, T3 and T4. So in the secretion of this T3 and T4 hormone, these goitrogen agents are interact and to decrease the hormonal level, increase the hormonal level in the hyperthyroidism disorder. So this increased level, elevated level is decreased by goitrogen agent. So that's why this agent is known as goitrogen. In which first one iron inhibitor and second one is thiamides. So in which first class iron inhibitor. Iron inhibitor like potassium thiocyanate and perchlorate when administered competitively inhibit the trapping of iodide by thyroid gland. Trapping of iodide means what? Means there is secretion of, after the secretion of thyroid hormone T3 and T4, then what happens? There is excessive level of T3 and T4 into the thyroid gland, and because of this there is trapping of this iodide is occurred. So this trapping is inhibited by iron inhibitor. So examples of iron inhibitor such as potassium thiocyanate and perchlorate. When they administered, they inhibit the trapping. Trapping means trapping of iodide. It is first step of metabolism of hormone. So this first step is inhibited by this iron inhibitor. Then it effectively controls the symptoms of hyperthyroidism. The symptoms which we are already discussed in the hyperthyroidism, such as fatigue, weight loss, as well as infertility, muscle pain, trembling hands. So all these symptoms effectively controlled by giving the anti-thyroid agents such as iron inhibitor. The next point, it is very cheap. Very cheap means they are available in the low price. Then they are less toxic means they do not cause any irritation. Then in therapeutic dose, it may causes gastric irritation, fever, skin rashes, and aplastic anemia. So if there is therapeutic dose is given, this anti-thyroid agent such as iron inhibitor, then sometimes it may cause gastric irritation. Gastric irritation, that is GIT tract irritation, fever, as you know, elevated body temperature. There is some rashes to the skin is occur, and aplastic anemia. Aplastic anemia, it is one of the type of anemia. What is mean by anemia? Aplastic anemia. It is occur sometime because of when therapeutic dose of anti-thyroid agent is to be given. Then what is mean by anemia? We are already
Reduce
discussed in
oxygen level in the blood.
drugs acting on blood system. So of anemia, it is a blood disorder where the decreased level of HB and also decrease in the oxygen carrying capacity. So aplastic anemia, it is also one of the type of anemia, and it develops the damage of bone marrow, that is bone marrow depression is occurred. This is known as aplastic anemia. The next point is preparation. In the preparation, iron inhibitor, their examples are potassium thiocyanate and perchlorate. They act as a iron inhibitor, and goitrogen, that is this agent inhibit and interfere the thyroid hormonal synthesis and decrease the elevated level of thyroid hormone. So in their preparation, potassium perchlorate 600 to 800 mg per day in divided dose, and the maintenance dose is to be 2000 to 200 to 400 mg per day. So this is dose of iron inhibitor agent. Then next is screen is visible to all.
Yes, ma'am.
Yes, ma'am.
Thiamides. So thiamides, these are the agents when they administered. Then they block the thyroid hormone synthesis by inhibiting the coupling of iodotyrosin. This one asks for MCQ. Both the agents having same pharmacological action, that is inhibit the hormonal synthesis, but thiamides, they inhibit the coupling in between the thyroid hormone, that is they inhibit coupling of iodotyrosin. So these are the agents, they act as antithyroid agent. By their action is block the thyroid hormone synthesis by inhibiting the coupling of iodotyrosin. Iodotyrosin means T3 or T4.
T3.
T3.
Triiodo means T3. Thyroxine or iodotyrosin means there is coupling in between the T3 and T4. This is inhibited, and also this agent block the thyroid hormone synthesis. These agents are rapidly absorbed after the oral administration. After the oral administration of this thiamide agent, then they get rapidly absorbed. The next point, they are rapidly metabolized in the liver. That is, this is about pharmacokinetic absorption, distribution, metabolism, excretion. So they rapidly absorb, then rapidly metabolized in the liver and excreted in the form of urine. Unchanged form is excreted in the form of urine. The next one, these are the agents, they may produce effect like fever, skin rashes, edema, and arthralgia. Edema for the edema of feet and arthralgia. So what is mean by fever? Roll number
Increased
66.
temperature of body.
Roll number 66. Are you present? 72. Are you present? Fever, it is effect produced by thiamide. So what is fever? What happened? Roll number 72. Sound is audible to all?
Yes, ma'am.
Yes, ma'am.
Neha Kamble, what happened in fever condition?
Skin rashes.
72. Your sound is not audible. What is fever? कोणता क्लास स्टडी करतो आपण? रोल नंबर 72. काय क्लासिफिकेशन मधला कोणता क्लास आहे? Screen is visible, then read it. Thiamides, it is visible or not? Roll number 72.
Yes, ma'am.
What is fever? What happened in this condition? "72, I am asking to you. Tell me the answer and then mute, unmute yourself. Thiamides, these are the agents, they may produce effect like the fever, skin rashes, edema of arthralgia. So here fever, that is elevated body temperature. Skin rashes, that is inflammation, irritation to the skin. And then next one is edema of feet. Edema of feet means And last one is arthralgia. So here arthralgia means there is pain to the joint, and edema to the feet means swallowing of the feet. So these are the effects they are observed when thiomides administered, or this effect produced by thiomides. The next one is preparation. Profile thiouracil dose
50 mg
it is taken
300
in 15 mg tablet and dose 300 to 450 mg per day. Then methimazole 5 to
5
10
to
mg tablet and dose 5
tablet.
to 20 mg. The next drug
Carbimazole.
Carbimazole.
Carbendazole.
Dose
5
5 mg
5
tablet.
mg tablet.
their dose 30 to 60 mg per day. So this is about preparation of second class into the goitrogens is thiomides. Then next after the goitrogen, second one is third one is iodides. Iodine is quickest acting drug in hyperthyroidism. So iodine it is a quickly or fast acting drug in condition of hyperthyroidism. It shows antithyroid, it acts as antithyroid agent and produces antithyroid activity. During iodide therapy, glands become less vascular. Thyroid glands during the iodide therapy, this thyroid glands becomes less vascular. Then during the therapy, gland starts to accumulate or gather or to collect the organic bound iodine. During the iodide therapy, the thyroid glands start to collect the organically bound iodine. Then iodide produce their antithyroid effect by rapidly shutting off the release of performed thyroid hormone. Iodide produce their antithyroid effect to treat the hyperthyroidism disorder by rapidly shutting off release of preformed थायरॉइड हार्मोन म्हणजे जे थायरॉइड हार्मोन रिलीज होतात त्यांचा रिलीज स्टॉप केला शटिंग ऑफ दॅट इज स्टॉप or prevent the release of this hormone at that time this iodide produces their antithyroid action. Then this effect is referred as thyroid constipation. So this will also ask for objective question, which antithyroid agent produces thyroid constipation effect? Then answer will be
iodides.
Iodides.
Iodide.
iodide. So iodide they produces their antithyroid effect by rapidly shutting off that is stop of release of preformed thyroid hormone. Then iodides may produce iodism which is characterized by skin rashes, then rhinorrhea and increased salivation. So these iodides they are given to treat hyperthyroidism disorder. Then they may produce iodism and this iodism it is characterized by skin rashes. Rhinorrhea, what is mean by rhinorrhea? Rhinorrhea means runny nose. Then this is again related to nasal congestion. Then rhinorrhea and increased salivation. So increased salivation means there is increased secretion of salivary gland. So iodide may produces iodism. Iodism means if there is excessive administration of this iodide to treat the hyperthyroidism disorder, then this iodism is occur. Iodism means there is poisoning of iodine because of excessive level of iodide. So this iodism is characterized by skin rashes, rhinorrhea, and increased salivation. The next preparation of iodide. In their preparation, Lugol's iodine it is used as a antithyroid agent to treat the hyperthyroidism disorder. So it is prepared by dissolving 5 grams of iodine in 100 ml of 10% solution of potassium iodide. जे 10% पोटॅशियम आयोडाइड सोल्युशन आहे ते 100 ml मध्ये घ्यायचं आहे आणि त्याच्यामध्ये 5 ग्रॅम आयोडीन डिझॉल्व करायचं आहे and provide 150 mg iodine per ml. So this preparation is used as a antithyroid agent. So preparation of iodide is known as Lugol's iodine. This one also asked for MCQ. The next and the last class radioactive iodine. Screen is visible to all.
Yes, ma'am.
The next and the last class in anti-thyroid agent is radioactive iodine. What are the examples?
I-131 iodine.
I-131.
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 Radioactive iodine. So iodine 131, that is radioactive iodine. It is effective and safe for the management of thyrotoxicosis. Thyrotoxicosis, it is too much level of thyroid hormone into the body. So to treat this condition, these radioactive iodines are used. Then molecular quantities of I-131, that is radioactive iodine, their proportion, it is used for selective destruction of thyroid cell. When there is destruction of thyroid cell, then they inhibit the excessive secretion of thyroid hormone. So by this way, this radioactive iodine acts as an anti-thyroid agent. I-131, that is radioactive iodine, it emits the 30 particles. Sorry, radioactive iodine, they emits the beta particles which destroy the thyroid tissue. Means जे beta particles आहेत त्यांना ते emit stop करतात and they because of this they destroy the thyroid tissue, and because of destruction of thyroid cell and thyroid tissue, there is lower or no synthesis of thyroid hormone in the thyroid gland. By this way, this agent acts and it is available. This radioactive iodine I-131, it is available in the capsule and solution form for the oral administration. Means they are given by oral route. The main drawback of this therapy is high risk of development of hyperthyroidism. The drawback of this using this radioactive iodine, there is high risk of development of hyperthyroidism. Means they are used as an anti-thyroid agent or anti to treat the hyperthyroidism disorder, but they may produces more chances or more risk of development of this hyperthyroidism disorder. That's why they are rarely used. So mainly used preparation as anti-thyroid agents are potassium thiocyanate perchlorate, that is iron inhibitor. They directly act on the thyroid gland and inhibit the synthesis. Also, thiamide separation are also used, such as carbimazole, methimazole, and propyl thiouracil tablet. So this is about anti-thyroid agent. Here we complete anti-thyroid agent.